Perfect. Okay, so good morning. I'm David Tomas. I work at Merck, and I'm going to spend just 5 minutes, as Julian explained before, to put just a few messages around buffer peptone water and the pre-enrichment step for infant formula. So again, we need to put these disclaimers on from First World War. We are Millipore Sigma in US and Merck in the rest of the world. And so during I have few slides. I just want to highlight the importance of the pre-enrichment step. So as already discussed, we are using more and more rapid technologies, but all technologies, the cultural methods, the ELISA methods, the real-time PCR methods, any method requires the pre-enrichment step to get enough concentration of the bacteria to be detected. So it's something that still is required, and I would say for the next years will be still required. So here you can see examples on infant formula. On the left, you can see a graphic, and you can see the orange line showing that salmonella, even if you spike salmonella at a very high level that is not expected in a real sample at log 6, meaning 1 million salmonella per milliliter, you can see that during pre-enrichment, this salmonella concentration, instead to growth, can decrease. And can decrease, for example, in this real example, after 15 hours, you can get no salmonella in the pre-enrichment broth. And this can be generated because the decrease on the gray line of the pH. So you can see that at the very beginning, the pH was neutral, around 7, and then after few hours, the pH decreased at 4.5, meaning the limit for salmonella, it's considered too low to grow salmonella. And this may be produced by the presence of probiotics in the enrichment broth, for example, but also for other ingredients that can decrease the pH during salmonella enrichment. On the right side, you can see from a paper from my colleague Hans Josten, published in 2006 in the International Journal of Food Microbiology, showing again real examples with different types of probiotics, when you can see that the pH of the pre-enrichment culture after incubation drops until 4.3, 4.4, 4.3, and the recovery of the different salmonella strains spiked are 0, meaning no recovery of those strains. So this is something that may happen during pre-enrichment, and again, it's crucial to assure that the pre-enrichment is correctly performed to avoid false negatives. Also in the international standard is described, so in the SACE 887 series, it's also mentioned that for acidic products, the pH needs to be neutral when preparing the initial suspension, but also not only for products that are acidic at the very beginning, but samples that which continue acidifying the product during incubation must have enough buffering capacity to have pH above 4.5 to avoid these false negatives. So it's something that it's important because we need to guarantee the result, but also because we need to adhere to the international standards. So to finalize, I just would like to stress on the left side, you can see what is the composition of your pre-enrichment broth on the initial suspension. And again, the food is playing an important role because it's 10% in volume. It's a big volume of product compared to water. So of course, most important is the water, that is almost 90% of the initial suspension, and the water quality in laboratories, it's important, of course, but you have in the buffer peptone water few ingredients according ISO, and you cannot change these ingredients. These ingredients are described in the reference method, and you need to follow those recipes. But you only have sodium chloride to put the osmotic stress, to reduce the osmotic stress, and then the phosphate buffers to keep the buffering capacity, and the peptone. And you can see that the peptone, it's very, very few compared with the rest. So you need to play with a very good peptone to be sure that pre-enrichment we have a good performance, and that's the key point on the that you can play with, because the others are managed by the recipe, but the peptone is a natural source that has a big impact on the growth. On the right side, just to finish, you can see that those ingredients, just this few portion of the initial suspension, may have a big impact on buffering capacity. So you can see in the graphic that the blue lines are two different products from Merck that they have a very strong buffering capacity when adding chloride in your initial suspension. So with a strong acidic material like chloride, then you can see that you need a big amount of chloride to reduce the pH when compared with other buffer peptone waters that are in the market, meaning that the buffering capacity is increased by 2 when using the buffer peptone water following the ISO recipe. So to finalize, the two messages is for all technologies, pre-enrichment is crucial to avoid false negatives, and also the buffer peptone water plays a critical role on the good recovery of your pathogen.